Okay, hi everyone, thanks for coming back for another episode of Sez the Vet. I'm Dr Sez. Research has been done into comparing the pain of some of these procedures, and we do know that ringing with local anaesthetic, so injecting a numbing agent, is less painful than doing it without the numbing agent, go figure, which is less painful than removing them surgically without any pain relief. I shudder at them carrying out this experiment, surgery without pain relief. Ugh. But just note that this is referring to the immediate acute pain. There's also a long-term chronic sort of pain to consider there, which we'll come to in a sec. So we are considering two different types of pain here. Acute, which is that intense immediate pain, and then chronic, which is that longer term kind of dull ache or whatever it may be, but it's that long-term pain. Now with ringing, you're looking at an acute high level of pain lasting for about 4 hours up to 8 hours. This then dulls as the nerves start to die and the tissue breaks down to fall off over the next 3 to 4 weeks, during which time some animals will continue to show pain behaviour. So that acute pain lasts for 4 to 8 hours, and then over the next 3 to 4 weeks we have a chronic pain. Now, not all animals will continue to show pain behaviours over 3 or 4 weeks. Some of them do, and their growth is affected, while others don't show the behaviours so much. Now, whether that's because some feel pain more than others, or because some are just more stoic than others and put on a tough face because they're a prey species, we obviously can't ask them, we don't know. What we do know is that the younger you do it, the less pain they feel. So we have laws set by MPI, and then they also have gold standard recommendations on top of that. So hear me out till the end here. Now, by law, castration without pain relief must be performed when the animals are as young as possible, not greater than 6 months of age. It is recommended to do as early as possible. The Welfare Code recommends that you do it in the first 4 weeks of life. If you can do it in the first week or two of life, pain behaviour is actually really minimal. So I recommend in the first week or two, I would be doing it as soon as I can. The older they are, the more developed the nerves and vessels are, and the greater the pain. Legislation also says that a cattle beast or a sheep that is over 6 months of age must not be castrated unless throughout the procedure the animal is under the influence of an appropriately placed and effective local anaesthetic through a vet. So this is that numbing agent injected in. That numbing agent does only last for about an hour and a half. So remember that acute pain is going to last past there, but at least it takes the sting out of the initial insult. It says that when we use rubber rings, they have to be placed above the testicles, make sure they're both down, and below the teats. So make sure you don't get the teats caught up in the ring, okay? And it must be a ring of appropriate size for the size of the animal. Now this last part is because if you use a band that is the wrong size for the animal, the blood flow is not going to be stopped from entering the testicles, but it can't drain back out. So it goes in and it can't come out. So what we end up with are these basketball-sized swollen testicles, incredibly painful, that still have living tissue inside, and part of them are dying, part of them are living. They end up needing to be removed surgically. I see this every year in people using the wrong size for whatever reason. It's not okay, and it's actually not legal. You do need to make sure you use the right size there. So legally, that's the line. But MPI does have clear best practice recommendations, which means that it's not technically law yet, but the welfare concern is certainly recognised, so it's highly recommended to do more. And those recommendations are: provide pain relief when any animal is castrated at any age. The area where castration is to be carried out, so wherever you're doing it, the equipment you're using, your hands, the animal themselves, where the ring's going on, need to be dry and clean, and this is to prevent infection. So try not to do it on wet animals after the rain. That muddy water is just going to run into any wound. Vaccinations should be carried out as well, and that's to prevent clostridial infections. Things like tetanus is a common one people think of. So make sure they're up to date there. Please remember, mums do need to have a vaccination booster in the last 4 weeks before lambing, for those antibodies to pass through her colostrum and protect the lambs. So if she hadn't had a recent one before lambing, then the lambs are going to need to have their own anti-tetanus shot and vaccination course. Now, just a note on surgical removal. Of course, rings are less painful in the intense acute phase compared to surgically without pain relief. Of course, no one should ever be performing surgery without pain relief. But removing them surgically with pain relief removes that 4-week chronic discomfort period. So I do personally perform plenty of surgical castrations on pet sheep and goats with sedation and heavy pain relief to remove that initial acute pain, because then you don't get any of that long-term pain. It's just a skin incision and it heals quickly. But of course, if you're going to sedate them and remove them surgically, then you've got the risks of sedation, infection and bleeding, that kind of thing. So it has to be done for the right client. It really has to be done right or not at all. Okay, we can't remove them surgically on a fully grown animal with no one around to monitor for bleeding and turn them out in a muddy paddock. That's not going to be a thing, okay? But that's my 2 cents there anyway. So I work with a lot of lifestyle block animals where they're pets and people are very aware, very concerned about their level of pain. So that's what we do there. We go full haul. Now, pain relief at home. I really hope you've made it this far because there are options for you now. If you have it done by a vet that's very welfare inclined, or if you ask for it, they can really take care of any pain for your little one. So if they come to me, for example, they have local anaesthetic injected into the testicles to numb the inside. They have numbing cream put on the skin as well to numb the outside. And these numbing agents only last for about an hour and a half. So they also have an injection of a 24-hour pain relief, and the owner goes home with a few doses of oral pain relief if they feel like they need it over the next few days. Now this is like ibuprofen for animals. Now at home, depending on your vet, of course, you can use the numbing cream on the skin, which will soak in to a certain extent. And there is also now a new form of meloxicam, which is that ibuprofen type drug, which absorbs across the gums. It's made and licensed specifically for tail docking and castration of calves and lambs. So you give the dose just in the mouth about 30 minutes before you put the rings on, and the pain relief lasts for 24 to 48 hours. So there you have it. Do it in the first week or 2 of life. I'd give them a few days just to get on their feet, but other than that, try and get in as quickly as possible. Use your oral pain relief and your numbing cream if you can get your hands on it. Use an appropriately sized ring on a clean, dry animal. Make sure you get both testicles down, or they'll end up needing surgery anyway. And keep those teats out of the way. Yes, ram lambs have teats. Okay, I'm going to leave it there. Don't forget to subscribe by hitting the emblem down the bottom of the screen. Thumbs up and leave your comments below over on the YouTube channel, and I will see you for the next one. Cheers guys, bye bye.